I want to speak directly to our 760,000 state health plan members about important changes coming to your health coverage in 2026. We value your service and your commitment, which is why this challenge has been my first priority since I took office. We're being as transparent as possible about this very important benefit for you. We have some good news for you, and we have some bad news. But let me be clear, none of the changes we're going to make have been made lightly. Just how bad is the situation? For 7 years, you have not had any increases to premiums or other costs. In that same time, healthcare costs have ballooned by over 25%. The plan's Board of Trustees has worked hard to shield members from that inflation, but that has meant for years we've been using cash reserves to plug the hole. But those reserves are now nearly exhausted and we've reached a financial crossroads. The plan is facing a staggering $507 million deficit in 2026, so we must act now, or healthcare as we know it for our state's public servants could go away. Simply put, this means starting in 2026, state health plan coverage will be more expensive for many members. But this burden is not only on you. It is also shared with the state, which has invested an additional $100 million in tax dollars next year to offset some of those rising costs. Thank you to our state lawmakers who prioritize this funding in a tight budget year. But also, healthcare providers from Murphy to Manteo have stepped up and gotten their costs down for our plan members. That means they are taking less for the same services. This three-pronged approach is the only way we're going to get on track. I know you're wondering how we got here. There are two key drivers behind this. First, the plan has been spending more than it brings in. While employer contributions have risen, claims, especially for our non-Medicare population, have increased at an average of 5.7% a year, compared to just 3.3% in funding growth. As my kids might say, that math isn't mathing. Second, the Clear Pricing Project has not worked and is costing the state over $100 million each year. The only right answer here is to end that experiment and go in a different direction. So now let's talk about the changes many of you have been hearing about. In 2026, most of you will have higher premiums. It is not ideal. We know that. But it's necessary. We vote on the exact monthly costs on August 15th, and rest assured, we are keeping that number as low as we can. Please don't get too frustrated because we do have some good news about premiums as well. I'll have more on that in 1 minute. Let me pause for a moment and address our Medicare members, though. We have found a way to keep your costs steady. There's only one small hurdle to this. You'll need to carry 2 ID cards next year instead of 1. Separating medical and pharmacy benefits under the Humana umbrella in 2026 creates meaningful savings while maintaining current benefits. Just 2 ID cards and a couple of extra notices due to federal rules. We'll make sure you are reminded of this several times leading up to that change, but make sure to save an extra slot in your wallet. Now, back to the non-Medicare members. Let's talk about the good news for you. As part of our renewed focus on better care at better rates, I'm proud to announce a new, no-cost partnership with Lantern. This sounds like it might be complicated, but it's actually very simple. Lantern will connect plan members to a high-quality, carefully selected surgeon when a planned, non-emergency procedure is needed. Think about shoulder surgery or a knee replacement. Here's the bonus. If you're a non-Medicare plan member, this surgery comes at no cost to you starting this fall. You heard that right. No cost to you. This is a major step in addressing our financial challenges while putting members first. Also new, and this will start in 2026, is our Preferred Providers Program. These doctors and healthcare practices have been identified as being committed to improving access to high-quality, affordable healthcare. When you see one of these providers, you will only pay the lowest copay for an office visit. Now, back to premiums. You've told us and we've heard you. It doesn't make sense to add your family to the state health plan if you have another option. The biggest factor to that is the current cost for kids. Well, we've crunched the numbers and we've found a way to cut that monthly premium. You shouldn't have to go look elsewhere for health insurance for your kids, and we think this new cost savings should be the incentive you need to have them join you on the plan. The mission of the State Health Plan Board of Trustees, and my mission as the State Treasurer, has been to safeguard the future of your benefits. We're committed to transparency. We're committed to fair partnerships with providers, and we are committed to listening to your feedback. Please continue to reach out and ask questions whenever you have them. Thank you for your service to our state and for your understanding as we navigate these necessary changes together.